There's two sides to chemistry. What are they? Acids are the corrosive side of nature, very aggressive. The main side, or predominant side of chemistry on this planet is called base chemistry, or another word that's highly used is alkaline chemistry. And this was very important because your blood is predominantly base chemistry. 7.4 is the pH of blood, or should be. So you can't dump acids into the blood without severely hurting yourself. Matter of fact, if your blood becomes acidic, what is the end result of that? Well, about 4 minutes from now, I'll be probably putting some flowers on your grave, because your blood can't be acidic without killing you. That's simple. So you can't put acids in the blood. It must be regulated. So phosphorus in your acid side, your nitrogen side of chemistry, is the lowest side of chemistry. Man has stood the other way. For some reason, medical doctors think protein is the cat's meow, and the body can't even use it. So what we have is a recommendation of high acid foods in life: grains, beans, meats, cooked dairy products. All these are highly acidic foods into a blood that is supposed to be alkaline. You can imagine that doesn't make the blood very happy. Matter of fact, the blood's shocked. Oh my God, if you just ate a piece of meat, you could die from that. Because of the dominance of acid chemistry in the blood, you could bring that homeostasis of blood down to the acid side. That's it. But the blood can steal something. The body can take calcium out of the walls of your arteries, out of the walls of your veins, out of your fingernails, out of your bones. But particularly out of the walls when it's your blood, it'll steal them out of the walls of your vascular system. And guess what your symptom's going to be then? Bruising easy, varicose veins, spider veins, hemorrhoids, brittle fingernails, osteoporosis, scoliosis. You can just keep going right down along like connective tissue weaknesses. Everything starts bulging, herniations from aneurysms, go right on down the road. The body's stealing from its structure to fight acids. Because in this world, in this planet, if acids win, you lose. National Geographic did a beautiful show on the Appalachian Trail, and they were showing all these states, and there was park rangers, forest rangers in each of these states checking the water. And this one forest ranger says, well, you see that six-legged frog down there? Whoa, wow, what's that six-legged frog? It's a mutated frog. Well, how did that happen? The forest ranger said, acid rain. The acids are coming out of the atmosphere. You know why? Because pollution is acidic. Some of these countries I can't even go into anymore because it burns me so bad to breathe. They don't have catalytic converters. Car exhaust, acidic. Factories, acidic. We've dumped acids. Matter of fact, in L.A., I heard there's a warning that if you're 70 years or older, move out. Because that mushroom cloud is a dark acid mushroom cloud, and lung cancer is skyrocketing in the 70-year-olders. So now you're getting a good understanding that acid side of chemistry, not necessarily our friend, we need it. Your body produces a few acids. Hydrochloric acid, that's stomach acid, and it's needed to release pepsin because your body cannot use protein. Your body can only use what proteins are made of, and that's called amino acids. You get plenty of amino acids in fruits and vegetables. All the strongest animals in the world do not eat protein. Notice that? Your primate families, very few do protein whatsoever, and that's only where they're trapped and are forced to. Unless it's that wild primate family right now that were released, where man got them stuck on meat eating. Now they're eating other monkeys. They're cannibals. Totally bizarre for that species. So your primate family and your herbivores, your elephants, your horses, and your cows, some of the strongest animals on this planet. Not lacking endurance, we use them for their power, and of course, very intelligent beings. And they don't eat any meat at all, no protein at all. What's that? And our species fits right in with the frugivore species. So this concept of protein, I could go over that for hours, holds no water whatsoever, and only serves to break down the human body. There's been one study after another study through the years, and last year, Shepard Smith was saying there was a 30-year study, I believe, linking high-protein diets to colon cancer. What they're not looking at is that same damage to kidneys. If your creatinine in your blood is more than 0.6, you're starting to lose your kidneys. I don't care if it's within normal ranges. You know, we look at things a little closer here in chemistry. So, watch yourself. So, what about your lymph fluid, though? Your blood has to be base chemistry, alkaline chemistry. Well, let's first establish a fact. Most cells, matter of fact, all of them I know of, eliminate waste. Got to. Essential. Because they're consuming. When you consume, you must eliminate, correct? So, cellular waste, what side of chemistry do you think most of them lie on? Absolutely. Acids. Acids are generally the byproducts of metabolism, respiration, all types of chemical interactions in the human body, outside of the human body. It's everywhere. Most of these byproducts are acids. That's why you can't have several pounds of acids being created at the cellular level or interstitially and eat acid foods at the same time. That's the man's problem, and he's going downhill on a fast-moving train. The genetics are about to kill us all. If I sit here and I'm talking to you and I'm working my muscle here, what am I creating? Lactic acid, right? Now, that's okay if what? If I can remove that acid. Is it my blood's job to remove that acid? What happens if the blood gets acidic? And you can't convert all acids to bases. That's stupid. Nope. You've got separate eliminative organs for that. You can see that when the skin gets backed up subcutaneously with acids. Eczema, psoriasis, all types of skin rashes. Absolutely. These are all acids. That's why it makes the skin red. What happens if you forget to change your baby's diaper in a timely manner? See a little rash on the bottom? How come? A urine rash? Where'd that come from? Acids. The same acids that are at the cellular level, but hopefully the bacteria in the lymph nodes took those 3 pH acids like phosphoric, carbonic, lactic acids and brought them up to about 6. And it's far better to have a 6 pH acid hit your kidneys than a 3, because it's 3 pH acids that causes cancer. Cancer is just simply a damaged cell by acids. What acids damage cells? Any of them. Pick them. Acids don't differentiate. They don't say, oh, you're a good cell, I'm not going to touch you, I'll get this one over here. They're acids. And acids are acids, and they will always be acids. The only way to stop an acid is with base chemistry. You don't stop acids with an acid. When you come into an emergency room, whether by ambulance or you're walking in, most emergency room visits is acidosis. So we start an IV, we hang a bag of normal saline, or the guys, the EMTs, did it in the ambulance, and they start running alkaline chemistry through your blood. Why? Because all trauma and all ER visits are dietary related or trauma. All acidosis. And of course we're going to start cooling you down. That's the same reason we use corticosteroids. Inflammation is acidosis. And we're going to give you steroids to back down that inflammation. Not the right way, but certainly in a stat situation, may be possible. You should, especially spinal cord stuff, so you don't damage tissue. The big issue is your lymph system's got to pull those acids out of there, not your blood. Your blood doesn't clean up the mess. Your lymph system cleans up the mess. Your lymph system is the janitor, and that cleans up the mess, not the blood. Your blood is simply the kitchen, bringing home the goodies. But your lymph must clean up all trauma, all tissue, all mess. That's why wounds don't heal well. Surgery doesn't heal well. Because they're always done where there is acidosis, where there's trauma, and you don't heal well. You cannot regenerate cells in your body in an acid medium. That's why medical doctors have no ability to regenerate tissue, and that's all we do is regenerate tissue and remember cells genetically, because we know the truth about energy, chemistry, and how the body works. We don't work on these antiquated theories that hold no water and has man afraid to look outside, afraid they'll catch something. So it's important that you understand acids and the vital need of the body to remove them. That's why the lymph system is a thicker, mucousy, lipid-based fluid, because it deals with the acid side of chemistry. Now, the acid side of chemistry, it's like a little Pac-Man. But what it does, acids create what they call an anionic environment. An anionic environment is an environment of coagulation and dehydration. So this fluid has a tendency to get thick. You ever cough up a real big mucus plug and how thick that is? That's what happens to the lymph system in your body. It gets thickened, hardened. Some of these tumors get hard as a rock. What's a tumor? Pocket of fluid. What kind of fluid do you think you're going to find in a tumor? Same kind of fluid you're going to find in a boil or a pimple? Or how about a cyst? Absolutely. You only have two fluids in the human body primarily. What are those? Interstitial fluids, blood and lymph. Blood and lymph. The dominant fluid, a little water, okay. Blood and lymph dominates the human body, period. End of story. So, real important to understand the lymph system, because that's where 99% of all the problems, all the pain, all the swelling. I don't care what arthritis it is. I don't care what lupus, Lyme's. I mean, they lump these as autoimmune. What's autoimmune about any of those? Nothing. That's your sewer system. And so what if you get a viral? Your sewer system is a dump. It's your culturing medium. You have no culturing medium, you have no problem. You have no acidosis, you have no pain and swelling. Congestive heart failure, pulmonary edema. These are all lymphatic problems. Gangrene, lymphatic problems. There's no such thing as diseases. If you want to empower yourself with knowledge, get rid of this idea and fallacy and concept of an illusion of diseases, because they don't exist. Everything is chemistry and physics in action. And you have cause and effect. And of course the overriding principle is the strong survive, the weak are consumed. And you must understand that cellularly and what nature does to eliminate its weaknesses. You also must learn in chemistry what the body does to fight acids. And your body has two main antacids in the human body. And those two main antacids in the human body is number one, cholesterol, and LDL, of course, is what your adrenal steroids are made from. HDL is phospholipids, all in the cell wall. Why? Protection against acids. Your body must protect itself against the use of acids. There is a protection with estrogen. Estrogen is acidic. But what protects the body from too much estrogen burn? Progesterone. How about testosterone? Progesterone. You can use any corticosteroid, would work. How about hydrochloric acid in the stomach? Bicarbonate from the pancreas. So if you have true acid reflux, you're going to have bicarbonate problems in the pancreas, aren't you? Absolutely. So understanding this war between the two sides and what the body has to do to win, because if acids win, you lose. Had my tonsils out at 16. So immediately when someone has their tonsils out, you know immediately they were having lymphatic problems. Tonsils are the lymph nodes in the throat. So you know immediately they were having GI tract problems immediately. And that probably in the wall, and we call that interstitial lymphatic constipation, which is exactly what interstitial cystitis is. But also malabsorption and all this. It's backed up all through the gut wall. Matter of fact, when the lymph system's backed up in the bladder, it's backed up all through the patient or client or friend or parents or whoever you're working on. It just is backed up all through them. And especially when the tonsils are out, you can tell they were really backed up interstitially, meaning around the cells, all the way through their bowels and intestines. And things seem to slowly decline from then on. Needed glasses at 18, and eyes get worse every year, started getting allergies. So you know immediately that her lymph system is getting worse, because all they did was remove the symptoms and the signs to tell you that the lymph system was backed up. Not understanding this from an academic viewpoint and suppressing the natural health people, even back in these years, they made everything worse. their egos have done nothing but make their side get worse, and the humans suffer and do nothing to help mankind. So it's just been that sort of thing. Now, I started turning hazel. So that means immediately, of course, she's starting to get her lymph system backed up big time. It's even changing the color of her eyes, and she's noticing this. Let's see, waking up with low back pain and having IBS. So immediately you know that irritable bowel syndrome, that's that tonsil backed up the lymphatic system through the bowel wall. Now it's burning her intestines from the inside out. So she's getting that IBS. Her eyes are getting blurry from the lymph system. Hair became brittle and thinning, started to see a chiropractor because of the unstable joints. She started getting unstable joints. Her joints would come out. Her shoulders would come out. Then diagnosed with asthma, so immediately you know, wow, we have an adrenal gland problem here. Well, we knew that already when you guys know the lymph system. The lymph system is the eliminative organs are the kidneys with the adrenals on top controlling that. So we already know that because her tonsils were out, that she had a lymphatic problem, that this problem came up through the GI tract, so that gave her IBS. Okay, so now it's in her head because she's getting blurry eyesight and she's having trouble seeing with that. Her hair's thinning because now the lymph is backed up, because you know it backs up all through your body. So now she's losing her hair because of the acids. Her eyesight's going because of the acids. Her joints are going because why? Why? How does the body deal with acids? Well, initially the adrenal steroids are what the body uses to fight acidosis. Cortisol, progesterone, all the corticosteroids, the steroids that are highly based in cholesterol. That's obvious. When the adrenals are down, the steroids are down. No matter what the blood work shows, the adrenals are down, the steroids are down. Then you start to see the body has to grab something else besides adrenal steroids. And being a systemic problem, there's acidosis head to toe, more work than weak adrenals can do. Then you're going to see the cholesterols coming in. But the other thing you see coming in is the loss of calcium. Remember, calcium is what the body uses to fight acids. It'll steal it out of the joints, particularly those joints you're working all the time. That's where you're creating more acids in the joints that you're working all the time, and that's where the acids are accelerated and they're pulling out. So then you start having joints, loose joints, snapping and cracking and popping, and that becomes problematic when what? When you have a parathyroid weakness and you can't put that calcium back. So now you don't have a way to solidify and strengthen connective tissue or skeletal tissue, and you start losing that. All right, this you're diagnosed with asthma, which is a neurological component to congestion in the lungs. So now you know her adrenals are down for sure. Or she's got to have low blood pressure at this time because she has low neural response to the lungs. This is the autonomic nervous system. With stomach problems coming in, that could exacerbate that problem. She was given inhalers, of course, not understanding. Again, medical not understanding what's up. So this suppressed congestion in the lungs, and so therefore this created more lung and breathing problems, oxygenation problems. Hangovers would become severe, and my left top of my rib collarbone started popping out of place and needing adjustment every week or two. Finally, at 26 years old, I crashed, hair falling out by handfuls, brain so messed up I could no longer drive. Throat muscle contracting, closing off. Well, is there any reason? First of all, she's highly lymphatic up, no tonsils, so they didn't do anything to fix her. They just removed the effect, so now she isn't any tonsils, so the throat can have more lymphatic, like a lymphedema, so her esophagus is swelling. Being low in calcium, she gets spasms and convulsions, spasticity, so she gets strictures, still probably not knowing that the diet can exacerbate this whole thing. No one's helping her there. Her throat was contracting, couldn't swallow, jumping and jerking at night, extreme dizziness. So you know immediately with the extreme dizziness, this is the cerebellum right back here in the back of the head. So, but that makes sense, doesn't it? Because you know she's losing her hair by the handfuls. She's got her constricture of the throat and spastic throat. She's got she's getting the neck problem. She's getting the shoulder popping out. Her joints are popping loose. So you're starting to see this is an extremely acidic, extremely lymphatic person. Her eyes move from blue to hazel, and so you're starting to see that subacute stages of lymph toxicity coming in, a higher acidosis to the body, this dizziness and vertigo. This is all the cerebellum here. Now it's affecting the cerebellum. A severe constipation because her nerves are down. Now she can't, her peristalsis and the thickness of the wall of her bowel is slowing down peristalsis. Was tested for Lyme, and my natural killer cell test showed there was low. So she had an NK cell, a natural killer test. Now these are your T's and your B cells. Now this becomes a little more serious because your B cells are bone marrow cells and the T cells are your thymus cells. But your thymus cells were originally B cells, so it always starts out in the bone marrow. Well, that means her bone marrow's breaking down. Well, what could break down bone marrow? Well, the same thing that breaks down any tissue, acids and the lymph system. And the problem with this is a denser level to get to. So this person is saturated with lymph stagnation, and the symptomology is all over, even deep into the bone marrow. She said her natural killer cells was as low as AIDS patients. So does that give you an indication of why AIDS? You know, HIV is just a virus, easy to detox out of the body. Why the AIDS? And that's going into like Hep C viral loads as opposed to hepatitises, stuff like this. Remember the role of viruses or antigens. They attach to weak cells. That's their job. If you don't have weak cells, you can have viral loads all day long. You get an HIV virus in your body all your life and not have a problem. When you see attachment, when you weaken the cells of your body, nature responds to that. Remember, nature responds to weaknesses. Termination. Not knowing what to do, I took 1 year of antibiotics and herbs. Then homeopathic tincture to detox, but it only crashed me even harder because homeopathics is not a detoxification system. They might use it as that, but that's not what they're good at. That's not what that's not their focus. They're still treatment-based thinkers. They should be there. They're the best at that, and they're good at that. All the past should be homeopathics. Then 1 year ago, I woke up with my heart racing so fast, I went to the ER. Fluid in lungs. Does that make sense? You know, what are the three things that your body uses to fight acidosis? Cholesterol, calcium, and edema, water. You start trying to hydrate. The body's in an effort because dehydration is the effect of acidosis. Fluid in the lungs and severe pancreatitis. Gallbladder removed. See, here's another thing. Remember, the GI tract is the trunk of this tree. So when she's backed up and the tonsils are removed, this is so much more serious than people realize because their whole tree is backed up lymphatically. The gallbladder and liver is just a branch over here. Her liver enzymes are elevated, of course. And then over here she had pancreatitis. That's just a branch. So you can see why she had both of those things. She has this all up. She has it in her lungs. She has it all through her. And so this is the lymph system chewing on her at every tissue you can find here. Then they just took her gallbladder out, of course, typical kind of thinking. But pancreatitis went on for months. They didn't know how to fix her. And these are not individual problems. They look to be individual problems, but they have one systemic problem. And it goes all the way back to her kidneys and her adrenal glands originally and her inability to move lymph. And that's what this caused, then became a systemic nightmare for this case. Stomach is huge. She's bloated up. Candida's high because she's full of sulfa drugs. So she has high candida, just exacerbating everything and leaving uric acid in their wake, which is adding to this huge acidosis pool. Candida never lets up. Liver stings all the time. Her liver's burning all the time. Of course, it's full of acids in the wall, just like the pancreas still is. On this end of time now, this is where this individual can start getting cancers because these acids now have been in her so long that it starts becoming intracellular acidosis. That's not what you want. before it's intracellular or in the cell is still able to remove these wastes outside of itself. We call that inflammation when you lose filtration of the kidneys. Legs and arms get extremely sore and swell. Purple under the eyes is dark as soon because you know she's losing her kidneys, and that's just telling the world that she's having kidney problems. Her lower back, she's losing her lower back. Her nerves running down her leg are problematic. Her circulation's involved going down the leg. Something stings and my brain feels swollen. Well, she's getting swelling of the brain. And this is really problematic. And then you get the pressures in the head. And this is, this case, okay, I'll keep going. And I'm so tired I could sleep forever. Scary tired. So she has absolutely low neurotransmitters, no energy. Her endocrine glands are crashing. Her pituitary can start crashing. That'll crash the thyroid and parathyroid, which you know she already has a parathyroid with her joints always popping out like this. When you see an instigator of symptomology, 9 times out of 10, you're going to use the word acidosis. And when you use the word acidosis, remember there's only 2 sides of chemistry. So you're going to go with the corrosive side, obviously, in most cases. Now, we can look at alkalosis, but you've got to have a lot of blood work and really look at the pHs of everything to be able to determine alkalosis. And quite frankly, most of the issues is acidosis. So you're going to acidosis, of course, robs chemistry, coagulates, dehydrates, and of course can throw a person into neurological spasms, tremors, seizures, convulsions, blah, 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 blah. To get out of pain and suffering, you must get these acids out of your body. To quit forming stones, you must get this acidosis out of the body. Well, there's only one system that is acid in the system, in your body. Blood isn't acidic because we wouldn't be talking with each other if your blood was acidic. Death is within a few minutes. It's the lymph system. That's why everything is lymphomas, and that's why everything is inflammation and cholesterols and lipids and all this. This is your lymphatic system. And your lymphatic system, whether they believe this or not, is directly tied to your skin and kidneys. Your physical body is simplistic, but very, very chemical. And so it's chemistry that must help you. And magnetics, of course, energy, and all of that. So keep health simple. Know that to get out of pain and swelling and all of these acid conditions, you have to eat alkaline. Well, an alkaline environment is not a protein environment. An alkaline environment isn't a dairy food environment. An alkaline environment isn't a grain or nut or dead animal environment. These are all acids. So you have to be careful in the type of diet that you choose. And as we've said, understanding your species, I've always said in the last videos here, is number one in helping you to understand we are a frugivorous species. And how interesting is it that our problems seem to disappear when we, 1, go raw, and 2, even sometimes kick up to a higher fruit, berry, and melon diet. For all neurological conditions, whether it's cerebral or Bell's palsy, whether it's MS, Lou Gehrig's or Parkinson, spinal cord injuries, tremors, convulsions, seizures, I don't care what it is. You need to live on a fruit, berry, and melon diet, period.